Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. The temporal bone contains the smallest bones and most delicate structures in the entire human body. How do we capture submillimeter details inside the ear without blurring? Today we are exploring high-resolution temporal bone CT. We will explain what patients experience during a hearing loss scan while breaking down ultra-thin collimation, bone algorithms, and dose optimization for our technologist community. For patients experiencing hearing loss, tinnitus, or chronic ear infections, a temporal bone CT provides an essential 3D roadmap. While an ear doctor can look at your eardrum with an otoscope, they cannot see the tiny hearing bones or inner ear chambers tucked deep inside your skull. This fast, non-invasive scan allows your specialist to check for fluid, bone damage, or structural causes of hearing loss to guide your treatment plan. The scan itself is completely painless and takes only about 5 seconds of actual scanning time. Because the bones inside your ear are thinner than a pencil lead, remaining completely still is the most important thing you can do during the test. Your technologist will rest your head in a comfortable foam holder and ask you to hold your breath and avoid swallowing for just a few seconds. For our technologist community, capturing petrous bone microanatomy requires maximizing spatial resolution. Acquisitions utilize submillimeter detector collimation, typically 0.5 to 0.625 millimeters, to yield isotropic voxels. Having equal dimensions in the X, Y, and Z planes allows artifact-free multiplanar reformations along the true anatomical axes of the ossicular chain, semicircular canals, and internal auditory canal. Reconstruction algorithm selection directly impacts edge definition at high contrast boundaries. Technologists must apply high spatial frequency bone algorithms, sharp kernels, to resolve delicate trabecular patterns and cortical margins. While sharp kernels increase image noise, the high contrast differential between dense bone and air-filled mastoid cells produces excellent signal-to-noise ratios for diagnostic evaluations. Evaluating temporal bone CTs requires systemic review of key anatomical landmarks. Axial planes should display the classic ice cream cone appearance formed by the malleus head and incus body. Technologists must also confirm ossicular continuity, assess cochlear turn integrity, check for semicircular canal dehiscence, and track the bony fallopian canal housing the facial nerve to assist surgical planning. Standard bone window settings are often insufficient for ultra-dense temporal bone structures. Displaying the stapes footplate and delicate oval window without blooming artifacts requires expanding the grayscale dynamic range. Technologists should utilize extended temporal bone windows, setting window widths around 4,000 Hounsfield units and window levels between 700 and 1,000 Hounsfield units. Protecting radiosensitive tissue like the crystalline lens of the eye is vital during high-resolution head imaging. Technologists can optimize radiation protection by angling the gantry parallel to the orbitomedial line to exclude the orbits from the primary beam, utilizing organ-based tube current modulation over the eye level, or applying iterative reconstruction to lower overall exposure requirements. High-resolution temporal bone imaging directly empowers life-changing ear surgeries. By providing a precise 3D blueprint, these CT scans help ENT surgeons plan delicate stapectomy procedures or map the exact pathway for cochlear implant electrode insertion, restoring hearing and improving quality of life. Temporal bone CT combines ultra-thin collimation and specialized reconstruction kernels to visualize the body's smallest structures safely and accurately. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.